Hi, I'm Susan Chainer with Sage Leadership Strategies, and I'm your host today of Community Forum. And I have the great pleasure to have with me Lisa Rosenthal, who is a fertility patient advocate. Welcome, Lisa.
Thank you. Glad to be here.
Glad to have you on the show. So I want to brag about you for a minute, about your very accomplished biography here, that you've been a fertility patient advocate for over 30 years. Your own story brought you to this. We're going to hear a little bit about that, but that you started as Vice President of Resolve of New York City. Then you helped found the American Fertility Association, which I guess is now Path to Parenthood. And now you're currently working at the Reproductive Medical Associates of Connecticut. And you also have quite a following on Huffington Post. You write a blog.
I do.
So let's start with, how did you come to this work? Can you just tell us a little bit about your journey?
Absolutely. So I got married at 24, which is very young, and I started trying to get pregnant at 26, and I assumed it would be a breeze because I was young, I was healthy, there was nothing wrong, I got my period regularly, so we assumed all systems go. We'd try to get pregnant. Within 3 to 6 to 9 months, we'd get pregnant, and it didn't happen. And then it didn't happen, and it didn't happen. And my best friend and partner in crime had actually been struggling with infertility herself, and I started to attend some meetings, Resolve New York City meetings, and within a year I was in treatment, and what I thought was going to be a short journey ended up being 6.5 years in treatment and trying to conceive. It was a very long time. Very, very long time.
That must have been so difficult.
It was, and with some of the most difficult parts of it, I think, for everybody today. And one of the things that hasn't changed at all in 30 years is, how do you feel old at 29? How do you feel old at 30 or even at 26?
Yeah.
And I remember being told by doctors, you're a baby, it's going to be fine. But you know, after 1 year, 2 years, 3 years, 4 years, it wasn't happening. It didn't feel fine, and it didn't feel like it started to feel like it would never happen.
Yeah, of course.
Yeah.
So, I mean, how did you and your husband keep your spirits up during all this? I mean, you must have had a lot of ups and downs.
We did, and you know, definitely support groups helped for me, and that's why I still to this day facilitate a peer support group, because I know that the professionally led support groups are also enormously important. We actually did seek counseling and saw a therapist together, which I think really did save our marriage.
I was going to say, it must have been a real strain on your marriage.
Oh my gosh, it was terrible. It was really terrible, and there's so much shame and guilt with infertility, which is interesting because the American Medical Association 6 days ago designated it as a disease, which the World Health Organization has said for years.
Isn't that interesting?
And as part of my background, as part of Resolve New York City and the American Fertility Association, we lobbied, so it was almost a decade ago that the Americans with Disabilities Act, that they designated infertility as a disease. So it's interesting that a disease causes so much shame and guilt.
Yeah, but in a way now that it's labeled a disease, maybe it feels like it's okay for people now. Isn't that crazy that it has to be like labeled a disease and you can't help it?
Well, you know, the physicians that I work for, one of the things they say that I love is getting pregnant is not a skill set. This isn't, right?
That's funny.
Because if that was true, right, people wouldn't get pregnant when they didn't want to. But the truth is that there's a lot of pushback. I mean, we changed the language from infertility to fertility. The American Infertility Association is how we started, and we changed it to the American Fertility Association. We wanted to be more positive. We wanted to talk about empowering people, men and women, and all gendered people. But the truth is that it is a disease. It's a dysfunction of your reproductive system. It's really that simple, and it can happen. It happens and transcends everybody.
And I think whether you're a man or a woman, whoever kind of, some couples like whose fault it is or whatever, I'm sure in both cases either somebody doesn't feel like a woman or the man doesn't feel manly, you know, whatever it is, it sort of affects it in a very personal way.
Very much so. And in fact, in a straight couple, it's 1 in 8 couples that will struggle. 40% of the time, it's the woman's fault or problem. 40% of the time we call it male factor or female factor problem, and 20% of the time it's called unexplained or idiopathic infertility.
Really, those are the stats?
Those are the
So
exact
isn't that
stats.
interesting? So you could say, hey, you know, half the time it's one of us, and then the other 20% is, who knows, maybe us
Right.
together.
And what is interesting sometimes is that when a couple is having trouble conceiving, so infertility is defined as the inability to get pregnant, again, in a straight couple, inability to get pregnant after unprotected sex at the right time in a year. And what the suggestion
That's
is...
the time frame. So it's been 6 months or 9 months, you can't claim it.
Well, actually, we say that if a woman is over the age of 35, that they should actually seek help after 6 months, because the statistics, the ability to
down.
help somebody after the age of 35 starts to go down drastically.
So it sounds like you must have gotten pregnant around 31, 32? I'm doing the math
Finally,
correctly.
yes, very good. Yes, 31 or 32. Mhm.
I mean, you know.
Yeah, yeah.
Well, so that must have, I mean, what was that day like?
I literally felt, I was on a table like that. I literally felt, I was sitting on my coffee table, I don't know why, and I literally fell off the table. And it was...
Oh, don't want to do anything?
No. It was, you know, the problem is, unfortunately, I was delighted, I was ecstatic, I was shocked, I was frightened.
Yeah.
I had had 2 miscarriages. The statistics with miscarriages is 1 in 4 women experience miscarriages. And so I was really relieved when we saw a heartbeat and heard a heartbeat. And yes, but it is unfortunate too that you also get into this system of failure. So you don't become pregnant, and then when you do become pregnant, it's scary because you're used to things not going right. And so unfortunately, I've had so many people walk into Ladies' Night In, our peer support group, walk in and say, I'm pregnant, and burst into tears because they're terrified. They've had losses,
Yeah.
you know, they've had things not working out and not working out. And these are, you know, very young women. You know, like I said, I was 26 when it was not working.
So at what point did you feel like you could sort of relax into it and anticipate it?
When I held my baby.
The whole time you were
I really, you know, there were problems throughout the pregnancy, not big problems, but when you get into that system of things not going right, sometimes, unfortunately, you just start to assume things aren't going to go right. So I would say that I truly relaxed when I held my daughter.
Oh, that must have been like unbelievable.
Unbelievable.
I mean, it's unbelievable anyway,
It
anytime
is.
a baby's born, but especially when you have to work so hard at it.
It is, and it is interesting how infertility stays with you to some extent. There were times that, you know, I looked at my daughter and I said, you know, when I was either losing my patience or, like, you know, what did I get myself into? Because
Right. Being a parent is the hardest job in the world.
it is, and it doesn't matter how many years you've dealt with infertility. Sleepless nights are sleepless nights. But I would say to myself, this child was almost not here. You know, I almost didn't have her. So it kind of affects you for a long time.
Oh, I'm sure. And then you were able to have 2 more.
Yes, I was blessed enough to have 3 daughters, 1 at a time, which is a really big point here too, that with infertility and fertility treatment, we really want to emphasize that 1 healthy baby, 1 healthy pregnancy, 1 healthy family at a time. And you know, pregnancy rates are so high at a good fertility practice that there's something called elective single embryo transfer. So if you're at a practice that has good rates, and you should be, you want to be at a practice that is that reports to the CDC, the Center for Disease Control, and SART. You really want to, if you can, transfer 1 embryo at a time, because you know the twins and triplets and quadruplets, very often they are healthy, and very often the pregnancies are very challenging.
I mean, there's so many more multiple births these days.
Yes.
For that reason. I mean, so many more than when we were growing up.
Yes. Well, and there are guidelines from the American Society for Reproductive Medicine, and the guidelines are pretty strict, and if you're part of their organization, as most fertility practices are, then you're following their guidelines.
Okay.
And the even better fertility programs restrict themselves. If you're at a practice where they're putting in more than 2 embryos, then it's because their pregnancy rates aren't high enough. And really the idea is,
Okay.
again, and you know, fertility treatment is pro-family. And that's a phrase that we're really, that we advocates have been using. We are pro-family. There's over 5 million IVF babies. And no, they're not babies, they're adults, they're having their
That
own
many?
children.
Wow.
Oh yeah.
So I know that sometimes after a couple's had one child, sometimes they can experience infertility after that to get pregnant the second time. But I know you said that after your first one, you didn't have the trouble for the
We
second
did
two?
not experience secondary infertility,
So
which
just
is
who
very
knows if
common.
a switch was flipped or something? I mean, who knows why? Suddenly
Yeah.
you didn't have that problem.
You don't always know why, and sometimes you do. You know, but secondary infertility can be awfully shocking. And one of the things that people don't realize about secondary infertility is the things you can't escape. If you don't have a baby, you don't have to go to playgroups. You don't have to pick up your child at daycare.
Right,
all
right.
of those things. You don't have your 3-year-old asking about a brother or a sister.
Yeah.
So, but primary and secondary infertility, you know, they have one very big difference. And that big difference is you still are a mom or a dad with one child when you are not with no children.
Yeah. Wow. So you went through your own journey, and then it sounds like it was a bit of calling for you to then jump in and help other people. How did that transition happen?
You know, they went hand in hand. I think that by the second or third month that I was trying to get pregnant, I was already going to resolve meetings and involved. And when I saw particularly that, again, the shame, the guilt, the embarrassment, as you referred to it so beautifully, you said it beautifully, that we feel less than. We feel like, you know, I'm a woman or I'm a man, this is what we're made to do, and it's not happening.
Yeah.
And it was interesting because I started with this almost at the same time as the AIDS epidemic, and there was more coverage on the AIDS epidemic than there was on infertility.
Oh, isn't that interesting?
It was easier to be out about being gay or being straight and having AIDS than it was to be infertile, which was shocking to us.
Wow.
And which is a nice lead into fertility preservation and cancer as well.
Yeah. So tell us, the viewers, about the bill. What happened here?
Well, you know, so Connecticut is a very progressive state, and I'm very grateful to live here. I'm very grateful to work here. And we've had a wonderful, so aside from the bill, separate from the bill, we've had a wonderful state mandate in place, one of only 15 states in the country to have a state mandate. So many companies in Connecticut cover infertility, and let's say like 50% of the patients at RMA of Connecticut are covered by the state mandate and would not be able to seek treatment without it. And the Connecticut state mandate, I believe it's 3 IUI cycles and 2 IVF cycles.
Why is Connecticut so progressive in this regard, do you think?
I think that part of it is politics. I think part of it is that the insurance companies have grown up in Connecticut.
Yeah.
Yeah, I think so. And part of it is, frankly, the practices in Connecticut have been very proactive. And so and 2 years ago, actually, the age restrictions on that state mandate were listed because they were deemed discriminatory, which was wonderful because at the age of 40, there was a cutoff. So aside from that, just recently, really I was really honored to be in the Senate gallery. I was there for almost 8 hours in the Senate gallery waiting for this bill to come up.
A couple of weeks ago.
A couple of weeks ago, for the Fertility Preservation Bill. Melissa Thompson, an incredible fertility advocate. This woman had breast cancer, so she had a baby at 32, and like many people, had a little trouble nursing. The baby was about 3 weeks old. Turned out she had stage 3 breast cancer.
That developed while she was pregnant?
Must have.
And they didn't know
Right.
because, wow.
So she went ahead, she got approval from her insurance company and went ahead and did a egg stimulation so that she could preserve her fertility in case she wanted to have children after she was done with treatment and had survived and was in remission, and was approved and then was denied. And so the day before her egg retrieval and 2 days before a double mastectomy, she was handed a $12,000 bill. And that was 17 or 18 months ago, and she's been fighting ever since. Representative Matthew Lesser has done an amazing job. He's been trying to get this bill through for a while.
So she had to pay that bill?
She had to pay that bill. But they created this Fertility Preservation Bill, which I was honored to have a very tiny part in. But, you know, to be able to applaud it, to be able to do anything for this. Because the idea that somebody should have to choose between a full remission and treatment and having a family is just, it's reprehensible. So we are fully expecting Governor Malloy, thank you Governor Malloy, we are fully expecting him to sign it. This was unanimous and bipartisan in both the House of Representatives and the Senate. Standing ovation, in fact, in the Senate.
Oh, wow.
10 o'clock at night. It was amazing. It was really an amazing experience to watch our government work so beautifully together.
So there was a limit at the age of 40, and I'm wondering, because the fertility dramatically declines anyway in the best of circumstances after 40.
Fertility declines dramatically, believe it or not. Well, first of all, at 35, but actually fertility declines dramatically at 25. Something that a lot of us don't know.
25? Really?
And actually, unfortunately, while we may not be ready for babies, fertility declines dramatically after the age of 20.
What?
I know.
I mean,
amazing.
I mean, I've read statistics after, 35 and 40, but I didn't realize.
Well, 35 and 40 are vastly, vastly different.
Yeah.
Very different.
Yeah.
And while the biggest problem after 40 is the viability of the eggs or the embryos because of advanced maternal aging. And that's again one of those places that really is demeaning to women, because all of a sudden they're being told they're old. They're 40 years old. We're not old at 40.
Right.
We're not old at our age, are
so
we?
So after 20, I mean, so what is that saying? Between 15 and 20, we should be having children? That's crazy.
I don't think it's what we should be saying, but if
That's
as
crazy.
a fertility advocate and as a mother, you know, the first time that a person goes to any kind of gynecologist, whether because they want to become sexually active at 15, 16, 17, and 18, because people do become sexually active at those ages. When they do a workup and they're given whatever form of birth control they and their parents or they choose, you know, that would be the perfect time to start a test called the AMH test, anti-Malarian hormone testing. It gives a baseline. So if there's any problem already, it's just something that we can keep an eye on. There's also something called PCOS, polycystic ovarian syndrome, which is the most common metabolic endocrine disorder for women ever. And it can really be very destructive to a woman's sense of self. Very often you're overweight, hair grows in places that most women just don't want it to grow. And these things can be picked up much earlier than when you're ready to get pregnant. So if we know that like a 17-year-old has a AMH that's a little off the charts low, does it mean she should get pregnant at 17? Absolutely not. But does it mean that she may want to freeze her eggs at 22? If she retests and find out that it's gone down again, it may mean that. And there are large corporations that are starting to cover egg freezing. It's no longer experimental. It hasn't been for years. And it's really a very viable option for somebody
I never
these
even
days.
thought about any of this. Wow. I guess I'm...
Well, when we talk to women about their careers and their educations, and I won't use my hands, I won't let them fly around, but I'm very passionate about this. When we plan our lives, we have to also take into consideration that our reproductive systems, women's reproductive systems particularly, mature much more quickly than any of our other systems. So our skin can look great at 50, and our muscle tone
I
can
know,
grow,
isn't
but
that
not our ovaries.
I think that I was always very career-oriented and wanted to have a family, and I always thought, I can do it when I want to. I mean, I'm one of 6 kids. My mother obviously was very fertile. She had 7 pregnancies. And
She had 7 pregnancies.
7 pregnancies.
And 6 children.
And 6 children. She had 1 miscarriage. But I always just thought, and knock on wood, I mean, I have 1 child, but I was fortunate. I realized how fortunate I was. I mean, I had her at 35 and a half, and I got pregnant right away.
You were lucky.
And I just said, okay, I'm ready, and Boom.
And infertility tends to be bad luck. That really is I mean, if you were to look at the umbrella cause of infertility, it's bad luck. It just simply is. I mean, there are lots of diagnoses.
Yeah.
But that's really what it is.
Wow. So, okay. So, so this bill passed, and you're doing a lot of other work. Your blog, how did that come to be?
So so I was working with RMA of Connecticut, and I was working as a patient advocate, and I wanted to be able to give folks a way to get daily support, really daily support. And I said, you know, on our website we have a blog, and the people I work with are so loving, really, they're so generous. And they said, Lisa, if you want to do it, do it. So I wrote a mission statement for Path to Fertility, and I started writing, and I have been writing for 6.5 years, 5 days a week, so it's over 1,400 blogs. And because
That's quite a schedule.
Because I'm so passionate about infertility, there are blogs about the weather. I can tell you, I can relate weather and infertility, right? The storms, these quick summer storms that come through, and then you feel better, and the rainbow comes out or the sun comes out, and then it storms again because you get bad news with infertility. And then I was honored to have been noted. I mean, Path to Fertility just won its first award from Healthline, actually, as one of the top 10 blogs, only blog on a doctor's website that won, which I was really happy about.
Why do you think it won?
Well,
if you could brag a little bit.
Okay,
I'm
I don't mind
why
bragging. Well, first of all, I think that 1,400 blogs, there's a tremendous amount of content. They actually loved effing funny Fertile Friday. You know, you have to have a sense of humor.
Right.
You know, crying is definitely part of infertility, but so is laughing till you cry.
Sure.
And particularly when a group of, the group of women we get together with regularly get together, there's some, funny jokes about where you've done injections, or, so yeah, effing funny Fertile Friday, they loved that one, and we love it too.
So where do you get your ideas for writing and to be that prolific for so long?
Well, my job as a fertility patient advocate means that I have a lot of contact with patients. I do the peer support groups, but my role is really that if a patient is having trouble, that they're either not communicating well with their nurse or their doctor, or they're having some sort of, they're just falling apart. And typically what I say is nobody walks into a physician's office. If you're in a straight relationship, you're not walking into your doctor's office to get pregnant. You would have hoped to have had hot sex with your partner and get pregnant. Right. And when that's not happening, there's already a sort of despair that happens. So some people walk in very excited because they're being proactive and they feel like they're going to get pregnant because they're going to a doctor. But many people feel a little defeated already when they walk in. I think that I forgot what you were asking me. I forgot. I said, where do I? So I get my ideas from them. Yeah. I get my ideas from them, and I get my ideas from what other people are talking about, and from the news. I mean, when the American Medical Association came out with that ruling designating infertility as a disease, that was really big news for us.
Oh yeah. Mm-hmm. And so do you write 5 days a week, or do you spend a day and you write 5 for the week and just schedule them? I mean, or do you just have ideas come out? Are you like a disciplined writer? Like, what's your process?
It's all of the above. There are times, I have a huge file called blog ideas where I'll start something and I don't like it. I throw it in there. And I may look at it 6 months later and go, oh, that's where it was supposed to go. Now I get it. I try to write every day. I really do. Writing is my artistic expression. I am a trained artist, and it really is my artistic expression these days. So I love to write. And so what happened was Path to Fertility was noticed by Huffington Post, and they invited me to come on as a writer. And I do a very different kind of blog for Huffington Post. Actually been talking a lot about adult children and how relationships have to change, right? Your relationship to a 2-year-old, 8-year-old, 12-year-old, 18-year-old, 30-year-old, very different.
So writing for the parents who finally got pregnant and now their children are growing up. So you can relay a lot of your own experience.
Right, and even giving mothers permission to realize that you may have struggled with infertility for 2 years. It doesn't make it any less exhausting when you've been up with a colicky baby for three or 8 or 12 nights. It doesn't make it any more less challenging when your child's throwing a temper tantrum in front of their great-grandmother and you wish you could sink into the floor and die.
Right.
You know, the truth is that once you're a parent, that child, not that impressed with the fact that it took you 2 years, 6 years to have them.
Oh yeah, right, exactly.
So you're really just a typical parent.
Yeah.
And sometimes, like, I will tell some of our beautiful folks who get pregnant, you know, just come back to me and call me when you're pregnant. And
like now you have that
the
baby.
Right. And I will remind you, it's really okay to feel exhausted, exasperated, irritated, like every parent does occasionally.
Yeah, so we have like 2 more minutes. I mean, the time's just flown by. So if somebody is on this journey, or maybe they're just starting to realize, wow, maybe we might not be able to get pregnant, maybe we might need help, what advice would you give them?
Well, the first thing I would say is please don't wait too long. The guidelines really are, if you're under the age of 35, having unprotected sex for 1 year is really the guidelines, 6 months over 35. But that's if you're menstruating regularly. That's if you don't have a history of infertility in the family, if you haven't had any kind of pelvic inflammatory disease, any other reason to suspect that pregnancy won't occur. I also want to remind people that it takes 2 cells to become pregnant. So a gynecologist telling you that you're perfectly fine is only answering half the question.
Yeah.
A semen analysis really needs to be done. But mainly that we are really blessed to have very, very good science and very good medicine. And like at RMA of Connecticut, there's an integrated fertility wellness program. So you could be doing fertile yoga, you could be seeing a fertility acupuncturist or nutritionist. It's not all straight medicine and straight science. You want to treat yourself as a whole person.
Okay, great, Lisa, thank you. So if anyone had any questions and they wanted to contact you directly, how would they contact you?
My email address is lrosenthal@rmact.com, and you can reach me through Path to Fertility as well. .com.
Okay, great. Thank you for coming on the show.
Thank you for having me. It was a pleasure.
You're welcome. I'm Susan Shaner with Community Forum. Until next time, thank you for joining us.